This is my student support system. Keep watching, keep learning. Good morning, students. Today we are going to discuss about syphilis. This lecture is in English, and if you want to study in Hindi, just click on I button and you will get link of Hindi lecture. Or you can directly visit to channel My Student Support System. What is syphilis? Syphilis is a sexually transmitted disease, or we can say venereal disease. It is an acute and chronic disease characterized by primary lesion, which is acute, and then secondary eruption, that is chronic, involving skin and mucous membrane. What is causative agent for syphilis? Actually, syphilis is caused by a bacteria named Treponema pallidum. It is a gram-negative bacteria, and due to its shape, here you can see spiral shape, these type of bacteria are known as spirochete. So in other words, we can say that syphilis is caused by a spirochete bacteria, that is Treponema pallidum. How it spreads means mode of transmission. It spreads by contact or direct contact, we can say, with the exudates from the lesions of the skin as well as mucous membrane of infected people, and it is always associated with sexual activity. Syphilis can also be spread from mother to baby during pregnancy, and transmission can occur through the blood transmission or blood transfusion if the donor's blood is infected with syphilis. What are the clinical manifestations? How we can identify? Clinical manifestation occur in three stages in the natural history of disease. These are primary syphilis, secondary syphilis, and tertiary syphilis. What is primary syphilis? In primary syphilis, it occurs in 2 to 3 weeks after the initial inoculation or infection with the organism, and there is painless lesion at the site of infection, and this lesion is called chancre, and normally it is at the site where the sexual contact took place. For example, on the penis or on the oral mucous membrane. Usually, this lesion heals automatically within 2 months, whether treated or not. Secondary syphilis. Secondary syphilis occur when the spread from original chancre to the other parts of body, and it leads to general infection if it is not treated. The rashes of secondary syphilis occur about 2 to 8 weeks after the primary chancre, and now it involves whole body, especially trunk, extremities, hands and feet, even soles and palms, and infection may spread to limbs, giving rise to lymphadenopathies, arthritis, meningitis, hair loss, fever, malaise, and weight loss are other signs and symptoms of secondary infection. Tertiary syphilis. After the secondary syphilis, there is a period of latency when the infected person has no sign and symptoms. If it is left again untreated, then 40% cases enters into the tertiary stage. Tertiary syphilis is a slow progressive inflammatory disease with potential to affect multiple organs. In this final stage, the disease is normally not contagious or not able to spread, but it infects the brain, heart, and other important organs of the patient. It leads to extensive damage and even death may occur. The laboratory diagnosis of syphilis is made by testing of blood specimens. Two types of tests are done for the confirmation of syphilis. These are RPR, means Rapid Plasma Reagin, and VDRL, Venereal Disease Research Laboratory. So in exam it is asked what is the full form of VDRL, or for which disease VDRL is performed. So you can give answer properly. Treatment. Recommended treatment for syphilis is use of antibiotics such as long-acting penicillin G, benzathine penicillin, 2.4 million unit as a single IM injection is given on the day of diagnosis, whether it is primary, secondary, or even tertiary. Alternative treatment for non-pregnant patients, especially ladies, and which have allergy to penicillin. So doxycycline 100 mg twice a day for 14 days, or tetracycline 500 mg 4 times a day for 14 days. And for congenital syphilis, again aqueous crystalline penicillin G 50,000 unit per kg body weight given IV or IM every 12 hours during the first 7 days, and then 8 hourly for 10 to 14 days. But main stress should be given on prevention. Emphasis should be placed on early detection and effective treatment of the disease so that spread of infection can be prevented. Health education to the community in general health promotion measures, and sex education also, that teaches the value of delaying the sexual activity until the onset of sexual maturity. Protection of community by preventing and controlling the STDs and VDs in sex workers and their clients, and discouraging multiple sexual partners and casual sexual activities. Teach the methods of personal protection such as condoms, correct and consistent use of condoms. Provide healthcare facilities for early diagnosis and treatment of STIs, means sexually transmitted infection, and encourage their use through proper health education to the community, and also explain the symptoms so that community can understand, people can understand that the client is suffering or he or she is suffering from syphilis. Make these services culturally appropriate and readily accessible and acceptable regardless of economic status. Establish active case finding programs that include interviewing patient about partner notification, means partner of the patient should be notified so that she or he can also start their treatment or diagnosis. For hospitalized patients, universal precautions for blood and body secretions should be taken. Patients should refrain from sexual intercourse until the treatment is completed and lesions disappear. A fundamental feature of the program for syphilis control is the interviewing of the patient to identify the sexual contacts from whom infection was acquired, and in addition to whom the patient may have given the disease or infected, means contact tracing and their treatment. Thank you students for watching this video. You can subscribe the channel and you can like Facebook page for latest updates of the latest videos, and for making your notes don't forget to visit mynursingstudents.blogspot.com. You can follow me on Twitter, Instagram, and join Facebook group Nursing Notes. Thank you. Have a nice day.